Hi, my name is Chris Sutton. I'm going to be doing a regional block nerve stimulator video number 5. So I'm going to make sure that I have, I'm going to check my pipeline pressure, make sure I have at least 50 psi, and make sure there's no crossover with my pipeline pressure, with my pipes. I'm also going to check my E-tank, make sure that it's at least halfway full, and then I have my key available. I'm also going to check my, make sure I have my ambu bag available. I want to make sure I have my suction available and make sure that it's working appropriately. I'm also going to make sure that I have my apples available and ready to go, and also have my extra airway equipment in case. I'm also going to check my flow meters, make sure my Link 25 is working appropriately. I'm also going to do my low pressure check. I'm going to pull out my bulb, make sure there's no leaks between my flow meter or with my flow meters or my vaporizers. I'm also going to make sure my vaporizers are full enough for this case. I'm going to make sure that I have AC power, and I'm going to calibrate my O2 sensor, make sure my CO2 absorber isn't exhausted or desiccated. I'm also going to check my monitors and ventilator settings, make sure they're appropriate for this case. I'm going to check my inspiratory and expiratory valves, and now I'm going to perform my high pressure check. I'm going to turn my machine to manual, turn my APL valve all the way off. I'm going to push my O2 flush to about 30 centimeters of water. Make sure that holds, and while I'm including the white piece here, and make sure that holds for at least 10 seconds, and it looks good enough for me. All right. Okay, now we're going to move on to our patient here. We have Anthony Hawk. He's a 30-year-old male. He has a BMI of 44, and that's based off of a height of 190 centimeters and a weight of 90 kilograms. He's a pro skater coming in due to a fall that resulted in a distal radius compound fracture. He has a history of tobacco use. His current medications are ibuprofen. His recent labs that were taken were CBC, CMP, and they were within normal limits. An X-ray was taken of his arm, and it showed that he does have a compound fracture in his radius in the distal region. Okay, so we're going to grab our patient here, Anthony, aka Tony Hawk, and we're going to ask him some questions. Okay, Tony. Do you have any medical problems? Do you have any medical issues with your heart, lungs, stomach, abdomen, or any head neurological issues? Have you had any previous surgeries? Have you had any issues with anesthesia in the past, or your family members? Have you or your family members had any issues with something that's called malignant hyperthermia? Are you currently taking any medications? Do you have any known allergies? What did you have for breakfast this morning? Are you able to climb 2 flights of stairs or walk 2 blocks without feeling winded? Now I'm going to perform a physical assessment. Hey Tony, can you open your mouth and stick out your tongue for me? Based off of this, he has a Malpotty score class 1. Tony, can you lift up your chin for me? It looks like he has a thyromental distance greater than 7 centimeters. Tony, can you bite your upper lip? I would say for his upper lip bite, he has a class 1. Tony, open your mouth as wide as you can. And I'm able to fit at least 3 fingers in his mouth. I'm also looking at his neck, and it looks like his neck length and girth is within normal limits. Tony, can you move your head side to side and up and down for me? And it looks like he has full range of motion. Okay, Tony, I'm going to listen to your heart and lungs. And I would say those are within normal limits. I would say that he has an ASA class or ASA 1. So the plan prior to surgery is to perform an axillary block with conscious sedation, and we're going to use a nasal cannula for O2 with oxygen and an end-tidal CO2 to monitor CO2 levels. If worst comes to worst, for plan B, we can do an intubation. Okay, now I'm going to talk to Tony about indications, risk, benefits, and alternatives for an axillary block. Okay, Tony, so for this block that we're going to be doing, the reason why we're going to be doing it is because it's for any surgery that's below the elbow. So this block is very appropriate for this type of surgery. Risks is we could possibly inject the local anesthetic into your vascular system, and it could cause something that's called local anesthetic systemic toxicity, but we'll keep an eye on that. Benefits is it blocks everything below the elbow. Alternatives is what we could do is we could perform a distal terminal blocks, or we could just do general anesthesia. So I've informed my patient and I've also obtained consent. Now we're going to perform a timeout. Okay, so now that we're performing a timeout, we have, this is Anthony Hawk. He is a 30-year-old male that is coming to have a distal radius compound fracture repair, and will be getting an axillary block in the right arm. We have placed our patient supine. On the ultrasound that we're going to be using, some of the landmarks that we're going to be looking for is the axillary artery, coracobrachialis, pectoralis major, biceps, as well as the triceps muscle. So for sterility, what I'm going to be using is I'm going to be using ChloraPrep, a sterile gown, a mask, sterile gloves. Make sure we have a good sterile field. Okay, we're going to go ahead and gather our equipment now. Okay, so the equipment that we're going to be gathering is, in order to perform this block, I have prepared syringes, as well as dosing stopcocks, and my Stimuplex needle, and a sterile ultrasound probe cover, and an LMA as a precaution in case we need to perform general anesthesia. Okay, so I'm going to go ahead and place my nasal cannula with that will monitor his end tidal CO2, but we'll do that afterwards. I won't put it on Daniel. I'm going to go ahead and place my EKG pads, my non-invasive blood pressure cuff, and also a pulse ox. Okay, and after placing a 20 gauge IV in his left forearm, I'm gonna inject him with 20 milligrams of Versed and 50 micrograms of fentanyl, just to keep him lightly sedated and comfortable. So the patient must be sedated enough to tolerate the procedure, but alert enough to follow commands and notify me of possible misplacement of the needle. Okay, so now we're gonna go ahead and perform the block. And I sterilized the field with ChloraPrep, and I've donned on my mask as well as my sterile gloves. And we have Tony right here. Okay, all right. Let's make sure you can see this. Perfect. Switch it around. I want to put my probe on kind of the crease of the armpit here. And if you look right here, oh, perfect, right there, right there. Okay, so we have our axillary artery, and around here, starting at 12 o'clock, you'll have the median nerve, and then 3 o'clock, the ulnar, and then 6 o'clock, you'll have the radial. And over here, that looks like the musculocutaneous, and right above that is the coracobrachialis, and below that, I would say right here is the biceps brachii. And so when performing this, I would insert this from anterior to posterior through the coracobrachialis. And we'll be using a nerve stimulator, so we'll go ahead and do that right now. Okay, thank you. Go ahead and get yourself cleaned up. Perfect. And the local anesthetic that we'll be using is 0.5% bupivacaine. We're going to probably give between 15 to 20 mils of local anesthetic total. Each area of the nerves will probably insert about 5 mils of local anesthetic. And again, we'll be using a nerve stimulator. And I'm going to be having a helper here, so we're going to have Nurse Daniel help me with aspiration as well as administering the local anesthetic. So we're going to insert a 22 gauge, 5 centimeter B bevel insulated needle. The ideal current is 0.3 to 0.5 milliamps in a slightly cephalid direction. So we'll go ahead and start with 1 milliamp until we have a muscle stimulation, and advance the needle above the axillary pulse until we have a stimulation of one of the nerves. So if we have, for example, if we have a radial nerve stimulation, we'll most likely see triceps twitching or forearm supination. And then if we have medial, if we get the median nerve, or if we're in the median nerve area, we'll most likely see forearm pronation or finger flexion, or if it's the ulnar, we'll most likely see finger or thumb abductions and finger flexion. And if we get the musculocutaneous, we'll most likely see some bicep twitching as well. Okay, so we want to make sure that twitching is stopped by about 0.2 milliamps. So let's say that I'm going in and I'm at about 1 milliamp and I see some twitching, so I'll dial it down till about 0.3. I still see some muscle twitching. If I'm at 0.2 milliamps and I still have some muscle twitching, that means I need to withdraw a little bit. So I'm going to withdraw a little bit, and I'm going to turn it down to 0.2 milliamps again. I have no muscle twitching, and as I go up to 0.3 and 0.4, I have muscle twitching again. That's a spot that I want to be in. So in each area, again, I want to give about 5 mil increments. So go ahead and aspirate. Make sure there's no blood. Perfect. Okay, now go ahead and administer about 5 mils, please. Perfect. And then we'll do that in each section. Before administering, I want to make sure that my helper is aspirating first, and then we'll give about 5 mils of local anesthetic for each nerve until we cover all 4 of them. Okay, perfect. Thank you. I appreciate that. Okay, so now that our patient has an axillary block, he is prepped and ready to go for surgery. Like I said, I didn't want to put this on Daniel, but like I said, he already has his monitoring pads on him. He already has his nasal cannula with oxygen, with an ET, with an end-tidal CO2, with monitoring his end-tidal CO2. Sorry, we'll just keep it like that. So this will be a MAC case. So this will be monitoring anesthesia. It'll be a monitor anesthesia care case. I have my emergency airways and meds on hand. The patient will be, like I said, on nasal cannula, on oxygen, with an end-tidal CO2 monitor. We'll keep him lightly sedated with propofol between 25 to 100 micrograms per kilogram per minute. And it looks like he's prepped and ready to go. He's ready for the surgeon. Thank you.